Senator Mitchell. Also, SB 538 has been put over till next week. Ms. Mitchell.
Good morning, sir.
You have 5 bills, 1 do pass and 4 suspense.
Yes, sir.
SB 655 has a do pass recommendation. Can you begin with that one?
I would be happy to. Thank you for the opportunity. This bill will create clarity in the Health and Safety Code by defining mold and adding it as a substandard living condition. The bill also guide tenants to notify a landlord when mold that is not tenant caused is found in their unit. As the analysis states, this bill will bring no new cost to the state, and any cost at the local level can be offset. We've continued to work with the opposition and have accepted amendments in this committee to remove the term demonstrable and added a cross-reference in civil code on a tenant's affirmative obligations.
Move the bill.
I appreciate that. With me today in support of the bill is Brandon Kitagawa from the Regional Asthma Management and Prevention Organization and John Lovell from the California Association of Code Enforcement Officers, and I ask for your aye vote.
Thank you. We have a motion by Quirk, a second by Holden. Please continue with your witnesses.
Good morning, Chair and members. My name is Brandon Kitagawa. I'm with Regional Asthma Management and Prevention. The science around mold has become increasingly clear. That there's a clear health connection, health risk associated with indoor mold, particularly for respiratory issues like asthma. The California Department of Public Health released a statement outlining these health risks in 2011 and clearly calling for swift correction of the water damage causing the mold, as well as safe removal and cleaning of mold and moldy materials. The challenge is that state code is not clear on mold, and so enforcement across the state is isn't consistent. There's very clear authority to address the water, but no clear authority on addressing the mold. And so this bill serves to close that gap and let local enforcement agents have a clear sense that they can enforce mold problems in homes. So we ask your aye vote.
Thank you so much.
John Lovell with the California Association of Code Enforcement Officers. We enforce these laws at the local level. This bill will provide important and needed clarity.
Thank you so much. Other witnesses in support, individuals from the public in support?
Chair and members, Kathy Mossberg with Public Health Institute, also in support.
All right. Witnesses in opposition?
Mr. Chair and members, Pat Moran with Aaron Reed and Associates representing the San Diego County Apartment Association. We're opposed to the bill. First, mold is a symptom of a condition of dampness. Dampness is already included in the substandard housing section, so we don't see actually the need for the bill. Number two, visible mold is not much of a standard. It's I see it when I know it when I see it type of thing. We think that that's unacceptable to us. This should be science-based, and when you consider the fact that code enforcement officers and the health officers who are doing the inspections of this have no, they're not licensed mold inspectors, and they have little, if any, training in determining what type of mold, if there is mold, how to remediate the mold. For those reasons, we're opposed to the bill. Thank you.
Eitan Zaitsu here for the Apartment Association, California Southern Cities, Apartment Association of Orange County, East Bay Rental Housing Association, NorCal Rental Property Association, North Valley Property Owners Association, and we're also opposed. I would echo what Mr. Moran just spoke to. The bill is vague and overbroad. There are no standards for determining what are acceptable or unhealthy levels of mold. If you go to the CDC website, they have a page dedicated to the topic of mold. There it states specifically that standards for judging what is an acceptable, tolerable, or normal quantity of mold have not been established. It's vague because landlords won't know how to what level mold exists. They won't know how to avoid mold. There's mold everywhere. There's mold in this room. There's mold in refrigerators, in garbage cans. The bill is overbroad. The CDC website also states that there are at least 300,000 different types of mold. But under the bill, any kind of mold would be subject to substandard housing laws. There's also going to be costs. There should be costs because code enforcement officers need to be trained. They need to be certified. They need to know they may be using other kinds of equipment. They may be doing other tasks with respect to mold. So there ought to be at least those kinds of costs. And with that, I submit.
Thank you so much. Individuals from the
Mr.
audience.
Chairman, Skip Dahm on behalf of homeowner associations belonging to the Community Associations Institute. For the reasons stated in terms of the lack of specificity as to what constitutes mold, our homeowner association volunteer nonprofit board of directors may be held responsible for this mitigation, as well as the managers. And I'd like to remind the committee that under this particular proposal, this could be a misdemeanor, and therefore the costs incurred would certainly be those of the nonprofit homeowners associations, leading up to getting vindicated from the allegation, as well as potentially going to jail because it's a misdemeanor. So for that reason, we either want homeowner associations out of the bill or oppose the bill. Thank you.
Thank you so much. Individuals from the public in opposition, Department of Finance. Oops. One. Just your name, organization, and position.
Sam Merrick, California Housing Alliance. We're professionals in the housing industry as well as environmental industry professionals in opposition to the bill.
Thank you so much. Department of Finance.
We are opposed to this bill because current law already defines substandard building to include dampness and habitable rooms, which is a conduit for mold growth. Additionally, these comments are based on the July 7th version of the bill. Additionally, the broad definition of mold could add to existing uncertainty in the code enforcement process, leading to the unintended consequence of removing housing stock from a market which may not be substandard. No fiscal impact.
Well, that was interesting. Questions or comments for the committee members?
Senator Mitchell.
Yes, sir.
In your opinion, would the nonprofit homeowners association be impacted by this bill?
The nonprofit
the people who testified in opposition, nonprofit homeowners associations, they felt that they would be impacted by the bill?
No.
They'd be held liable?
Oh, the homeowners association. Yeah, that's an issue that's come up repeatedly in policy committee. We have responded. According to Civil Code 5550, HOAs are required by law to visually inspect common areas of a property, such as roofs, plumbing, foundation, etc. We've also found code sections that refer to their covenants, conditions, and restrictions, commonly referred to as their CC&Rs, that give them access to individual units with 24-hour notice, those kinds of things. So based on our review of corporate code and the various civil codes and the CC&Rs, we know that the homeowners associations would not be personally liable for mold found inside a unit, although they do have a responsibility for common areas. There's an appellate ruling that says that they do have that responsibility. They also have a responsibility to respond to homeowners whose units have been damaged as a result of damage in a common area that they didn't attend to. And so we've addressed it in policy committee. I've said it repeatedly that we do not believe that they will be held responsible, and I think code sections and their OCC&Rs clarify that.
Thank you. One other comment. You can have, first of all, I do appreciate the opposition saying that there are some molds that are harmless and that they're around all the time. Perhaps you could address that issue?
Well, as I've said in policy committee repeatedly, this argument reminds me of the argument 20-some-odd years ago when we talked about lead and whether or not lead was appropriate in paint. And clearly the science is not completely there. But the point is that the code enforcement officers brought this issue to our attention because they don't have any guidelines by which to guide them in their review of units. In today's local paper, mold found in a Stockton classroom, but school is still in session. And so I think the science is still out there in terms of what mold is safe, what is not. We appreciate that mold is everywhere, but we all know that there are molds that are toxic, and different people have different reactions. And so the reason we brought this bill forward and have had this substantive conversation in policy committee is to begin the conversation, develop a standard that code enforcement officers can use so it can be applied consistently across the state. Just to clarify, as we've done in policy committee previously, code enforcement officers are trained, and they stated so in committee. They're trained in previous they've testified on the amount of their training that they've experienced, and that they can also make the distinction between mold that is caused by a tenant and that which is not. And so we've worked very hard with all of the representatives here today from the various associations to try to provide clarity, but I think it's a conversation that must continue, and it's not something that can casually be dismissed because mold is everywhere. There's good mold and there's dangerous mold, and we're trying to look at public health and safety, which is the code enforcement officer's responsibility.
Thank you for answering my questions very well.
Thank you.
Thank you so much. Mr. Gallagher.
Just a couple of questions. Senator, first of all, I mean, as you said, the science isn't really clearly there. It's not there. This, as my understanding, your bill would say any visual inspection of mold, regardless of whether it's toxic or not, that would be labeled substandard housing.
That's not correct, sir.
And, well, maybe you can go into that, but my concern would be that we're broadly, saying that any visual mold, which mold is found it's very common to be found in bathrooms. Shower steam can cause mold in a bathroom, but that's non-toxic mold, and
therefore the code enforcement officer would acknowledge that, and it would not be a violation.
So this allows for that, because my understanding is any visual inspection that finds mold, that they determine there's mold, it will be labeled substandard housing. And under this code section, most of the other things that we're calling substandard are things that do pose a health risk to people, health or human safety risk.
Yeah.
As we know, there are thousands of types of mold, and most of it is non-toxic.
So
and doesn't pose anything risk to health.
We're not going to have a back and forth. Ask a question, then a response, ask another question, and then a response.
And so the question you would like me to respond to is?
Yeah, so how do you make that distinction when the science isn't there, as you said? How are they going to make that distinction between what is toxic and what isn't? Because right now it seems like this is very broad-based. It covers all mold, whether it's toxic or not.
And then the second question I understood you to pose was, is any visible mold therefore substandard housing? Is that your second question?
That's what it appears to be in the language.
Why don't you start?
Well, so one... First, I think the way we're talking about science is a little bit off, but I'll defer that. But I think the issue that was the issue that came up after the first committee meeting, and one of the amendments that have been put into the bill is to say that it's any visible mold, excluding mold that is found essentially in areas that commonly have moisture. So showers, sinks, those sort of areas are explicitly excluded, and so. Essentially, the standard for this section of code in general is really based on the training and experience of the enforcement officers. And so currently, pieces of that code, there aren't any pieces of that code that have a clear scientific threshold in terms of when it's officially substandard and when it's not, except for something that says, is there hot water or not? That's the only place where there's a clear threshold. The rest of it is based on the training and judgment of enforcement officers. So you have essentially what it does is says, where are there health risks? So there are health risks associated with pests. Not every rat carries a disease. We don't require code officers to catch every rat and determine if that rat is a carrier before determining if it's a substandard condition. The science around molds, basically, what they're lacking is saying this amount of this mold or this specific part of the mold is what's the problem. What the science tells us now is that when there are reported damp, moldy, or visible mold or mold odors indoors, that's associated with asthma, increased risk of asthma, bronchitis, and respiratory infection. And so there's clear health risks associated with the presence of mold indoors, and that's what we're basing this on. And so the enforcement officers would then be trained. There are enforcement agencies that are enforcing mold right now, and so they train their officers to decide, is this a problem significant enough that it appears to be impacting their health, and they make their judgments accordingly.
Thank you. Let me remind everybody this is not a policy committee. We're not here to debate the policy. Any other questions or comments from the committee members? Mr. Wagner.
All right, so it's a fiscal committee. Let's talk about the Department of Finance's opposition. They're saying there aren't standards here. They're saying the science is unsettled, as I understood their opposition. I don't think all of the code officers are trained to determine mold. Any mold outside of a bathroom, I guess, is subject to a standardless determination. Some code officers might say that's okay, and others might say it's not. Why not fix that? Put the standards in that the opposition's asking for. Satisfy the governor's office and the Department of Finance. What's wrong with doing that?
Mr. Wagner, John Lovell with the California Association of Code Enforcement Officers. First of all, the assertions made by the opposition that code enforcement officers are not trained in this area is simply factually inaccurate. We do hundreds of hours of training every year in a whole host of responsibilities of code enforcement officers, including the area of mold. They are trained to determine if mold is caused by actions of the tenant or if it's caused by structural issues. As Mr. Kitagawa said, they've been trained on the consequences of indoor mold, particularly in confined areas. The assertion made that code enforcement officers are not trained and not competent is simply not true. One of the problems we have right now is because mold is not specified in the law, you have jurisdictions that do in fact go out and enforce the law with respect to mold where they find that it is a potential hazard. You have other jurisdictions who say, no, mold isn't specified, so we're not addressing it. But what we do know is that mold in closely confined areas presents serious health consequences. And the Code Enforcement Officers Association has been working over the last several years with the Healthy Housing Coalition to address these various issues. But to say that we are not trained to do this is factually inaccurate.
Let me try it this way, because what you just said I don't think addresses the concerns that have been expressed by the opposition. Regardless of how many hours of mold training your code enforcement officers get in that 100 hours, and maybe it's 1 hour, maybe it's 30 minutes, maybe it's 50 hours, I don't know. Doesn't matter, because the science is saying we don't know about all those. We can't train people because we don't know. We haven't done the research to be able to say with specificity, yes, this piece of mold is nothing worse than what you'd find in a bathroom, and we're going to ignore it. This is not. The training can't be there because the science isn't there, and that's what the Department of Finance, not just the opposition, is telling us. So I don't.
So this is. So the Department of Finance also had a position that this has no cost to the Department of Housing and Community Development and is a non-reimbursable mandate cost. They made a policy comment in a fiscal committee, and they should stick to the fiscal, as well as the opponents, proponents, and the authors of bills. This bill has been moved by Quirk, a second by Holden. This bill is out on a B. Roll call. And we have Daly not voting.
Are you cutting off further questions? Because I wasn't done.
This bill has been moved and it's out. You like to ask a question. You have 1 minute.
All right. I would like the author, if she would, to address the issue raised further by Mr. Quirk The homeowners association, we're told, won't be responsible. I understand that, but there are fiscal concerns that they raise, because when there's a finding of substandard conditions, the tenant is oftentimes, at least, if not all the time, relieved of obligations to pay rent. So maybe they don't have an obligation with respect to the mold, but isn't it true that these findings of a substandard condition based on a lack of science result in the potential waiver of the collectability of rent to the associations and to the apartment owners and to others?
I think the collectability of rent doesn't impact the HOA, it impacts the homeowner. And so I don't, so I will restate if that will help you to clarify, because that was not the question or the issue raised by the HOA repeatedly, is a fiscal impact to them if rent can't be collected. The homeowner collects the rent. The homeowner is responsible for paying the HOA fees. If I have an empty unit, that doesn't absolve me of my responsibility to pay my HOA fees. I pay that anyway, whether I have a tenant renting or not. Is that correct? Yes or no? Is that correct?
What is correct is that if the association were held...
No.
Well, hold
if
on.
I'm the homeowner,
what is correct
if I'm the...
Hold on. We're not interrogating, we're not cross-examining, we're not doing any of that.
I apologize.
Just answer the question, and then this is it, because the bill's already out of this committee.
Got it. The homeowners association would not be liable, as a practicing attorney, Mr. Wagner, as you would understand the term liable, they would not be liable. The homeowner has the responsibility. Again, I've stated, it has been stated repeatedly, that any visual sign of mold does not immediately mean a substandard clarification. We are providing guidance as requested by the code enforcement officers to begin the process of acknowledging the fact that there is some mold that is not tenant generated, that is harmful, and that we want the homeowners, recognizing that the vast majority of homeowners want to maintain the integrity of their property, as you and I certainly do and would.
Thank you. We'll take that as your close. Next bill. You have four bills on suspense: SB 23, SB 238, SB 359, SB 44.
Very briefly, Mr.
3. Stick to the fiscal issues. You get one witness in support, and then we will have one witness in opposition, and then we will take Me Too's from the audience.
Thank you, sir. Let's begin with SB 23, if that is okay with you.
Yes.
I'd like to note the SB 23 is a measure that seeks to remove the discriminatory and ineffective family cap in place for families receiving CalWORKs. Very briefly, just to give us some context about the bill, the MFG policy was passed before a lifetime limit on aid existed, before 30 hours of work was required, and when the maximum benefit was 80% of the federal poverty level. We now have, since this measure took place, lifetime limits on CalWORKs. Welfare to work is now 24 months, and the maximum benefit is 40% of the federal poverty line. Families living under the maximum family grant are living on grants as low as 26% of the federal poverty level. For 15 years, we have denied an additional $122 per month of basic needs assistance to our most vulnerable citizens, extremely poor infants. And we have no evidence that family caps have affected birth rates, which was the original false premise that led to the passage of the bill. What it has done is increase childhood poverty by undermining the very program intended to alleviate such suffering. It has a large price tag, which I'm sure finance, in their infinite wisdom, will share with you today. However, what I would argue is what they will not share is the long-term unintended fiscal consequences that we pay for infants who are born into poverty and are forced to live in poverty because of the maximum family grant. With that, I will ask one witness, Frank Mecca with the California Welfare Directors Association, to be my witness in support.
Thank you so much. Please proceed.
Thank you, Mr. Chairman. Frank Meck on behalf of the County Welfare Directors Association, who've long opposed the policy of the maximum family grant. With respect to the fiscal, the policy undermines your investment in the CalWorks program. On your behalf, county welfare departments are responsible for two basic things. We're responsible for mitigating and remediating the effects of very deep poverty, and we're responsible on your behalf to help people move from welfare to work. Both of these goals, the fundamental goals of the CalWorks program, are undermined by the Maximum Family Grant Program, and research is pretty clear costs society much more in the long run. The costs of very deep poverty are very clear. The research suggests that the cost to states and the federal government is in the hundreds of millions, if not billions of dollars. Children who live in very deep poverty suffer poor educational outcomes, employment outcomes, health outcomes, criminal justice outcomes, and the cost to society and lost productivity and the cost to other social systems is staggering. With respect to welfare to work, fundamentally what we're trying to do in the CalWorks program, when families live in very deep poverty, they teeter on and off the brink of homelessness. Many of them, a very alarming number of homeless families are on the CalWorks program. They want to work. They want to go to job training. They want education. But if you don't know where you're going to sleep at night, it's impossible to focus on what their ultimate goal is, and what our ultimate goal is moving from welfare to work. So if you want your investment in the CalWorks program to work, if you would like county human service agencies to accomplish the goals that you set out for us, you'll pass this bill and eliminate the maximum family grant rule. Thank you.
Thank you so much. Rest of the witnesses as Me Too's, please.
Catherine Williams on behalf of the ACLU of California and Access Women's Health Justice in support.
Jill Adams, Center on Reproductive Rights and Justice at UC Berkeley School of Law in support.
Western Center on Law and Poverty, Jessica Bartholow with the Western Center on Law and Poverty, a co-sponsor in support.
Thank
Claire
you so much.
Lipschultz with the National Council of Jewish Women, which is part of a larger interfaith coalition in support of SB 23.
Great. Individuals from the public in support.
Kevin Aslanian, Coalition of California Welfare Rights Organizations, for 2 centuries trying to repeal this. And we hope this is the right century.
Thank you.
Mr. Chair and members, Monica Miller on behalf of the Jewish Public Affairs Committee of California, as well as the Jewish Family Services of Los Angeles in support.
Christina Romero on behalf of Planned Parenthood Affiliates of California in strong support.
Thank you so much.
Thank you, Mr. Chair. Members, Mitch Seaman with the California Labor Federation, also in strong support.
Good morning. Sam Rodriguez on behalf of United Food and Commercial Workers in support.
Thank you.
Rebecca Gonzalez, National Association of Social Workers California chapter in strong support.
Thank you.
Martha Guerrero representing the Los Angeles County Board of Supervisors in strong support.
Pete Wywitty, California Partnership and the Health and Human Services Network, strong support.
Lori Furstenfeld on behalf of the Child Care Law Center in strong support.
Noé Paramo representing California Rural Legal Assistance Foundation in strong support.
Ronald Coleman on behalf of the California Immigrant Policy Center and the California Immigrant Health Network and also the Latino Health Alliance in strong support.
Thank you so much.
Shannon Smith Crowley representing the American Association of University Women in California, strong support.
Sandra Fluke on behalf of our Voices for Progress members throughout California, business leaders, philanthropists, entrepreneurs, frankly, folks who will never be impacted by the Maximum Family Grant, but care deeply about the families who are in strong support.
Khadija Alam Javed with the Advancement Project in support.
Thank you.
Dennis Garcia on behalf of the California Latinas for Reproductive Justice, co-sponsors of the bill, in strong support.
Nicole Wertelman on behalf of the Alameda County Board of Supervisors and Ventura County Board of Supervisors in support.
Thank you so much.
Kathy Mossberg on behalf of the California Association of Food Banks and the California Food Policy Advocates in support.
Khalif Asagai on behalf of the Children's Defense Fund California in strong support.
Karen Lang on behalf of Mayor Edwin Lee in the City and County of San Francisco and the Solano County Board of Supervisors, both in support. Thank you.
Thank you so much.
Rebecca De La Rosa with Latino Coalition for a Healthy California in strong support.
Thank you. Witnesses in opposition, individuals from the public in opposition, Department of Finance.
We do not have a position on this bill. We estimate costs of up to $222 million general fund annually.
Thank you so much. Questions or comments from the committee members?
All right, so I'll address the fiscal side. The cost is indeed significant.
That it is.
But I will say that there are a lot of folks on our side who are very supportive of pregnant women and encourage them to continue in that pregnancy. And it's important that we as a government then continue that funding. I think it's arbitrary, the cutoff. I applaud you for bringing the bill, and when it comes off suspense, as I certainly hope it does, I intend to be counted as a supporter.
I appreciate
the
that,
effort.
Mr. Wagner. Thank you.
That threw me off. Questions or other comments?
You have to be open to the possibility,
I know.
Mr. Chair.
I know. Would you like to close, Senator?
I noticed that time you didn't try to cut off my microphone.
That's because you were right, Mr. Wagner.
You stayed with fiscal. I appreciate that.
Again, sir, from the fiscal perspective, I think the reality is, from a fiscal perspective, this is a population who we eliminated this support to. This is a population in this year's budget we didn't do all we could have, and in my humble opinion, should have to reinvest in California's future, which are our children. Again, when we look at the long-term unintended consequences of children being born into and living in poverty, those are bills that we and those who come behind us shouldn't have to pay, nor should these children in terms of their own compromised ability to thrive as California residents. I acknowledge that it's a high price tag. The longer we delay removing this biased, antiquated policy from the books, the more it will cost. But there are approximately 140,000 children who are impacted by this policy every day. And I hope that we will look at it as an investment in California's future and support the elimination of the maximum family grant.
Thank you so much.
Thank you.
2 down, a few more to go.
Very quickly, sir. 238?
238, please.
All right. Again, another, quite frankly, policy-heavy bill. 238 will bring much-needed oversight and revised processes for the use of psychotropic drugs in the foster care system. Much like SB 223, a population that we as state policymakers have a responsibility for. Certainly children who are within the foster care system look to us, quite frankly, as surrogate parents. The San Jose Mercury News has led this effort in terms of acknowledging the excessive, I would go so far as to say abuse, and overuse of psychotropic drug treatment among foster care youth, primarily those in group homes. From the fiscal perspective, drugs are administered and re-administered as children move from one group home setting to another. There is no tracking system between the Department of Health and Department of Social Services from the prescriber and the department who has oversight responsibility for these children's well-being to really get a sense of who's been prescribed what. And so from a fiscal perspective, we recognize that there will be one-time costs that will allow for the development, training, and implementation of reporting and triggers in preventing over-drugging of our foster youth. But we are clear that in the long term, it's in the best interest of the children within our care that they are not overprescribed psychotropic drugs, and as a result have access to a full battery of mental health treatment, not just pills. With that, I'll turn it over again to Mr. Mecca to talk about their support.
Thank you. Thank you, Mr. Chair. Frank Mecca with the County Welfare Directors Association, co-sponsors of the bill. The bill provides all the practitioners in the foster care system 2 fundamental things that we need: information and training to deal with the very significant problem with the overuse of psychotropic medications. I would just add that the bill is pretty carefully crafted to leverage information sharing and matching activities that the Departments of Social Services and Healthcare Services were already undertaking before the bill was introduced. So we were leveraging activities that the administration was already doing. And with respect to training, we're taking advantage of federal funding that provides for most of the recipients in the bill a 75% federal match. So we do acknowledge some modest cost to the bill, but we have been very mindful about leveraging existing activities and leveraging federal funding opportunities to keep those costs to a minimum. Thank you.
Thank you so much. Individuals from the public in support, just your name, position, organization, and position, please.
Anna Johnson, National Center for Youth Law, co-sponsors of the bill and strong support. Thank you.
Tisha Ortiz, former foster youth, strong support.
Rochelle Trottenberg, former foster youth, strong support.
Alan Hertzfeld on behalf of the Judicial Council in support.
Rebecca Gonzalez, National Association of Social Workers, California, chapter in support.
Khalif Asagay, Children's Defense Fund, California in support.
Nicole Wurtelman on behalf of the Alameda County Board of Supervisors and Ventura County Board of Supervisors in support.
Robert Sumner on behalf of Attorney General Kamala Harris here in support.
Thank you so much. Any witnesses in opposition? Individuals from the public in opposition? Department of Finance?
We do not have a position on this bill. The responsibility for foster care was realigned to the counties in 2011. The bill imposes new requirements on counties, thereby imposing a higher level of service on counties that has a corresponding state general fund cost. The extent of these costs is unknown at this time. There would also be increased costs to the Department of Social Services and the California Community Colleges.
Thank you so much. Questions or comments from the committee members? Seeing none, this bill is on suspense, and it will be taken up next week.
Thank you, sir.